Welcome, everybody, to this event, which consists of a research and public health session about minimizing the impact of endocrine disrupting chemicals. And from now on, I will say EDC. It's a very long word. On health and environment. I'm Julie Søgaard. I'm an environmental journalist, and I will be your moderator today. And I find this a really, really important topic we are discussing today. I saw an interview with the Danish toxicologist Philip Grandjean the other day, who said that humans have so many toxics in our chemicals in our bodies now that we will not be accepted as food. So I think it's we are in a really bad shape at the moment. As it looks like. But we are going to hear much more about what these chemicals are doing to us today. During the two panel discussions, the audience in the room and online can pose questions to the speakers. Online audience, you must do it in the chat, a Q&A function. I will choose questions from that during the session. If you are writing about this on social media or other places, please use the hashtag #BecauseHormonesMatters. And after the event, there will be an evaluation sent out to you, so please fill that in if it's possible. There will be a coffee break after the morning session. And after the event, there will be a networking lunch. And all the scientific speakers here are independent scientists and do not have any conflicts of interest to report. And I will keep the introduction of the speakers brief because we have a tight schedule today, many speakers. But there will be more details about the speakers on the event site. And I will begin by giving the floor to the ESPE President Anita Hokken-Koelega, I hope I pronounce it right, and Professor Jérôme Bertherat, who was just days ago handed over his presidency of ESE after his 2-year term. So the floor is yours.
Thank you. On behalf of our two societies, I would like to welcome you to this high-level event on endocrine disrupting chemicals. We had here the last 4 days our first joint ever meeting where we joined the endocrine society, the European Endocrine Society with the European Society of Pediatric Endocrinology to discuss endocrinology across life course. This meeting was really very successful, and I think that the community is very pleased of that. And we really would like to make this event this morning as a kind of legacy in the city and the country where we had such a nice congress, and to leave something positive with the idea that our community, I would say even more after this meeting than before, when we discussed between pediatric and adult endocrinology about the consequences of endocrine disrupting chemical on health across the life course, our community really feel a strong urge and responsibility within the Europe to advocate for the importance of and the consequences of EDC as a risk factor for health and the environmental impact of EDC. And despite the fact that we are clearly in what I would call a quite unstable world, we must continue to work all together toward a better health and environment for everyone. On this slide, I just would like to illustrate the vision and the mission of our society, that is to shape the future of endocrinology to improve science, knowledge, and health. And for that, we unite, support, and represent our specialty. One major project that our two societies developed the last 2 years that was presented in this meeting is the EndoCompass Research Roadmap. This is a roadmap that defines the direction for the future of endocrine science. The basis of this roadmap is that endocrine diseases affect millions of people across Europe, and we are talking here about frequent disorders like diabetes, obesity, infertility, thyroid disorder on one side, but also rare disorders, and it's more than 400 rare endocrine disorders. So altogether, this has a huge impact on the healthcare and a societal impact. And the fact is that right now, research in this field is both underfunded and fragmented. And the Anglo Compass aims to change this situation in order to inform funding and policy decision at the European, but also at the national level, to enhance the coordination and visibility of endocrine research, to, on the long term, contribute to better health for all. So the Endo Compass clearly define research gaps in order to help articulate research priority in service of other funding mechanisms, to attract and encourage young researchers in endocrine research, which is key, of course, and the early careers of the two societies were very active also in this project, to align the endocrine community on shared research goal, to improve patient care by identifying clinical priority, and to drive innovation. And two areas were clearly identified: EDC and artificial intelligence in healthcare. So our two societies are the driver of this roadmap, but in collaboration with many other European societies. Just giving some example, the European Association for the Study of Obesity, the European Association for the Study of Diabetes, or the European Reference Network for Rare Endocrine Disease. And working on this project, we also have on board patient advocacy group that provide a patient perspective on these research priorities. So Anita will say about the ESPE division.
Yes, thank you very much. So I also welcome you on behalf of the European Society for Pediatric Endocrinology. And you can see on this slide, it's ESPE's mission to advance excellence in pediatric endocrinology, diabetes and bone disorders by promoting research, education and medical practice to the benefit of the child and the adolescent's health throughout the world. We are called a European society, but in fact, we have members and delegates to our congresses of more than 110 countries. So actually, we are important for the entire world. Well, we aim to be the leading society in pediatric endocrinology. In fact, we are maybe already the leading one. So it's also our responsibility then to take advantage of that and try to make the best of that, and to aim for excellence in clinical care, research and education, and then through innovation collaboration together, for instance, with the endocrine European Society for Endocrinology and Technology. And we are also having collaborations nowadays with the ESPE, the European Society for Liver and Gastroenterology in Children, because we feel that together we are much stronger than when we are just one society. I think we also like to thank the persons who are going to present today, and also those who have made this event possible. So we like to thank Professor Anna-Maria Andersen, Professor Anders Juhl, Professor Paulina Damdimopoulou is a difficult word still for me. Professor Joseph Curle and Professor Stefano Cianfrani, who have really invested quite some time and energy to make this event happen. We are also very grateful for the support we received from the Copenhagen Legacy Lab, and of course also many thanks to the professional ESPE and ESE staff who worked on this event while they were already very busy to organize the joint ENDO meeting, which had almost 8,000 delegates. So you can imagine it's really a major undertaking altogether. But when we go back to the topic of today, I must say this is very close to my heart, but also to the heart of our entire endocrine community. And why is that particularly for me? It is because children are very vulnerable, and particularly when they are still fetus, they are so sensitive. And not only because of themselves, but during fetal life, also the gonads are developing, and actually they have to serve later on for the children of the fetuses. So actually, many effects, and unfortunately we do not know all of that yet, will also be transitioned to the next generation, and that is a real threat. So it could be that it is now okay, but the next generation will be harmed by the endocrine disruptors. So I'm very happy that we have this event. I think we had a proposal to have one session on endocrine disruptors during the joint ENDO meeting. We just had, and actually it was a huge room, but the room was fully packed, and actually there were too many people. They were sitting outside. So there is now a really a concern, and there is attention to take this forward. So this event brings together more than 500 policymakers, NGO, patient advocates, industry representatives and scientists from across Denmark and the rest of Europe, and even from other parts of the world. So when we go to the next slide, well, this is I hope you can see it. It's a bit small. So today we have a program where, in addition to EndoCompass, we will show scientific highlights from the ESPE ESE Joint Congress to discuss relation between the EDCs and male and female fertility, obtain an update on the latest new approach methods, and what is the role we can and can't play with the current EDC regulatory framework. The session will be concluded with a panel discussion with an audience together with you, of course, then, where you will be able to pose questions, and I presume also when you are attending online. And so I think we wish you a very good meeting with a lot of information and networking. So thank you.